Section 13 of Aids to Forensic Medicine and Toxicology. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Aids to Forensic Medicine and Toxicology by W.G. Aitchison Robertson. Chapter 15. Potash, Soda, and Ammonia. Caustic potash occurs in cylindrical sticks, is soapy to the touch, and has an acrid taste, is deliquescent, fusible by heat, soluble in water. Liquor potassy is a strong solution of caustic potash and has a similar reaction. Carbonate of potassium, also known as potash, pearl ash, salt of tartar, is a white crystalline powder, alkaline and caustic in taste, and very deliquescent. The bicarbonate is in colorless prisms, which have a saline, feebly alkaline taste, and are not deliquescent. Symptoms: acrid, soapy taste in mouth, burning in throat and gullet, acute pain at pit of stomach, vomiting of bloody or brown mucus, colicky pains, bloody stools, surface cold, pulse weak. These preparations are not volatile, so that there is not much fear of lung trouble. In chronic cases, death occurs from stricture of the esophagus causing starvation. Postmortem appearances: soapy feeling, softening, inflammation, and corrosion of mucous membrane of mouth, pharynx, esophagus, stomach, and intestines. Inflammation may have extended to larynx. Method of extraction from the stomach. If the contents of the stomach have a strong alkaline action, dilute with water, filter, and apply tests. Tests: the carbonates effervesce with an acid. The salts give a yellow precipitate with platinum chloride and a white precipitate with tartaric acid. They are not dissipated by heat and give a violet color to the deoxidizing flame of the blowpipe. Stains on dark clothing are red or brown. Treatment: vinegar and water, lemon juice and water, acidulated stimulant drinks, oil, linseed tea, opium to relieve pain, stimulants in collapse. Do not use the stomach tube. The glottis may be inflamed, and if there is danger of asphyxia, tracheotomy may have to be performed. Carbonate of sodium occurs as soda and best soda, the former in dirty crystalline masses, the latter of a pure white color. It is also found as washing soda. Symptoms, postmortem appearances, treatment and extraction from the stomach as for potash. Tests: alkaline reaction, effervesces and evolves carbonic acid when treated with an acid, crystallizes, gives yellow tinge to blowpipe flame. No precipitate with tartaric acid, nor with bichloride of platinum. Ammonia may be taken as liquor ammoniae, hartshorn, as carbonate of ammonia, as cleansel, or as Scrubb's cloudy ammonia. Symptoms: being volatile, it attacks the air passages, nose, eyes, and lungs, being immediately affected, profuse salivation, lips and tongue swollen, red and glazed. The urgent symptoms are those of suffocation. Inhalations of the fumes of strong ammonia may lead to death from capillary bronchitis or bronchopneumonia. Death may result from inflammation of the larynx and lungs. When swallowed in solution, the symptoms are similar to those of soda and potash. Postmortem appearances, similar to other corrosives. Method of extraction from the stomach. The contents of the stomach, etc., must be first distilled, the gas being conveyed into water free from ammonia. Tests: Nessler's reagent is the most delicate, a reddish-brown color or precipitate being produced, but ammonia may be recognized by its pungent odor, dense fumes given off with hydrochloric acid, and strong alkaline reaction. Treatment: vinegar and water, other treatment according to symptoms. Fatal dose: 1 drachm of strong solution. Fatal period, shortest, 4 minutes. Chapter 16. Inorganic irritants. Nitrate of potassium, niter, saltpeter. Bitartrate of potassium, cream of tartar. Alum, double sulfate of alumina and potassium. Chlorides of lime, sodium, and potassium. All these are irritant drugs and give the usual symptoms. Chapter 17. Chlorate of potassium, etc. Chlorate of potassium produces irritation of stomach and bowels, hematuria, melena, cyanosis, weakness, delirium, and coma. Postmortem. Blood is chocolate brown in color, and so are all the internal organs, gastroenteritis, nephritis. Tests. Spectroscope shows blood contains methemoglobin. The drug discharges the color of indigo in acid solution with sulfur dioxide. Treatment. Transfusion of blood or saline fluid. Stimulants. Sulphuret of potassium, liver of sulfur, occurs in mass or powder of a dirty green color, has a strong smell of sulphuretted hydrogen. Symptoms. Of acute irritant poisoning, with stupor or convulsions. Excreta smell of sulphuretted hydrogen. Post-mortem appearances. Stomach and duodenum reddened, with deposits of sulfur. Lungs congested. Treatment. Chloride of sodium or lime in dilute solution. An ordinary treatment for irritant poisoning. Fatal period, shortest, 15 minutes. Chapter 18. Barium salts. Chloride of barium occurs crystallized in irregular plates, like magnesium sulfate, soluble in water and bitter in taste. Carbonate of barium is found in shops as a fine powder, tasteless and colorless, insoluble in water, but effervescing with dilute acids, and readily decomposed by the free acids of the stomach. Nitrate of barium occurs in octahedral crystals, soluble in water. Method of extraction from the stomach. Dialysis as for other soluble poisons. Tests. Precipitated from its solutions by potassium carbonate or sulfuric acid. Burnt on platinum foil, it gives a green color to the flame. Symptoms. Besides those of irritants generally, violent cramps and convulsions, headache, debility, dimness of sight, double vision, noises in the ears, and beating at the heart. The salts of barium are also cardiac poisons. Post-mortem appearances. As of irritants generally, stomach may be perforated. Treatment. Wash out stomach with a solution of sodium or magnesium sulfate, or of alum, and give stimulants by the mouth and hypodermically. Chapter 19. Iodine, iodide of potassium. Iodine occurs in scales of a dark bluish-black color. It strikes blue with solution of starch and stains the skin and intestines yellowish-brown. Liquid preparations, as the liniment or tincture, may be taken accidentally or suicidally. Symptoms. Acrid taste, tightness of throat, epigastric pain, and then symptoms of irritant poisons generally. Chronic poisoning, iodism, is characterized by coryza, salivation, and lacrimation, frontal headache, loss of appetite, marked mental depression, acne of the face and chest, and a petechial eruption on the limbs. Post-mortem appearances. Those of irritant poisoning with corrosion and staining of a dark brown or yellow color. Treatment. Stomach pump and emetics, carbonate of sodium, amylaceous fluids, gruel, arrowroot, starch, etc. Analysis of organic matter containing iodine. Add bisulfide of carbon and shake. The iodine may be obtained on evaporation as a sublimate. It will be recognized by the blue color which it gives with starch. Iodide of potassium. Colorless, generally opaque, cubic crystals, soluble in less than their weight of cold water. Symptoms. Not an active poison, but even small doses sometimes produce the effects of a common cold, including those symptoms already mentioned as occurring with iodine. Analysis. Iodide of potassium in solution gives a bright yellow precipitate with lead salts, a bright scarlet with corrosive sublimate, and a blue color with sulfuric or nitric acid and starch. Chapter 20. Phosphorus. Phosphorus is usually found in small, waxy-looking cylinders, which are kept in water to prevent oxidation. It may also occur as the amorphous, non-poisonous variety, a red, opaque, infusible substance, insoluble in carbon disulfide. Ordinary phosphorus is soluble in oil, alcohol, ether, chloroform, and carbon disulfide, insoluble in water. It is much used in rat poisons, made into a paste with flour, sugar, fat, and Prussian blue. Yellow phosphorus is not allowed to be used in the manufacture of lucifer matches, and the importation of such is prohibited. In safety matches, the amorphous phosphorus is on the box. Symptoms. At first those of an irritant poison, but days may elapse before any characteristic symptoms appear, and these may be mistaken for those of acute yellow atrophy of the liver. The earliest signs are a garlicky taste in the mouth and pain in the throat and stomach. vomited matter luminous in the dark, bile stained or bloody with garlic-like odor, great prostration, diarrhea with bloody stools, harsh, dry, yellow skin, purpuric spots with ecchymoses under the skin and mucous membranes, retention or suppression of urine, delirium, convulsions, coma, and death. Usually there are remissions for 2 or 3 days, then jaundice comes on, with enlargement of the liver, hemorrhages from the mucous surfaces and under the skin, later coma and convulsions. In chronic cases there is fatty degeneration of most of the organs and tissues of the body. The inhalation of the fumes of phosphorus, as in making vermin killers, etc., gives rise to phossy jaw. Post-mortem appearances: softening of the stomach, hemorrhagic spots on all organs and under the skin, fatty degeneration of liver, kidneys, and heart, blood-stained urine, phosphorescent contents of alimentary canal. Treatment: early use of stomach pump and emetics, followed by the administration of permanganate of potassium or peroxide of hydrogen to oxidize the phosphorus. Oil should not be given. Sulfate and carbonate of magnesium, mucilaginous drinks. Sulfate of copper is a valuable antidote, both as an emetic and as forming an insoluble compound with phosphorus. Fatal dose: 1 grain and a half. Fatal period: 4 hours, more commonly 2 to 4 days. Detection of phosphorus in organic mixtures. Mitscherlich's method is the best. Introduce the suspected material into a retort. Acidulate with sulfuric acid to fix any ammonia present. Distill in the dark, through a glass tube kept cool by a stream of water. As the vapor passes over and condenses, a flash of light is perceived, which is the test. End of section 13.